Hi everybody and welcome to Professor O, What Do You Know? I'm Professor O and today we're going to be going over intramuscular injections. Before I demonstrate how to give an intramuscular injection, I need to go over a few important things that you need to know before you go ahead and give that injection into your patient. So one of the things that you need to start out with knowing is what muscle you're going to be injecting into, and also what type of equipment you're going to be needing in terms of needle length and syringe size and things like that. So when you're giving an intramuscular injection, this is a medication that's going into the muscle, and we need to make sure that the needle is long enough for the patient population that we're using. So if you're dealing with a pediatric population and you're using the vastus lateralis muscle, you may be using a needle size length anywhere from 5/8 of an inch up to 1¼ inch long. If you're going into the deltoid of a child, you also may be using anywhere from a 5/8 to a 1¼ inch needle for the child's intramuscular injection. If you're giving an adult a vaccine and you're going into the deltoid muscle, we are usually using a needle size anywhere from 1 to 1½ inches long. And if we're going into the ventrogluteal muscle, we can use anywhere from 1 to 1½ inch long needle as well. It is no longer necessary to aspirate to check for blood return on an intramuscular injection. When choosing an intramuscular site, again, depending on what medication we're giving, depending on the population, the age population that we're dealing with, we need to understand what the appropriate muscle site selection is. So again, if you're using, if you're giving an infant an intramuscular injection, you're going to be going into the vastus lateralis muscle. For toddlers anywhere from 1 to 2 years of age, you're also using the vastus lateralis muscle or the deltoid muscle. For children or adolescents anywhere from 3 to 18 years of age, we're using again the deltoid or the vastus lateralis muscle. And for adults, we use the deltoid muscle predominantly for vaccines, and we use the ventrogluteal muscle predominantly for general intramuscular injections. When we are giving intramuscular injections, the angle of administration is always going to be 90 degrees. We can inject anywhere from 1 to 5 mLs into a muscle, but again, depending on what muscle we're using, if we're using the deltoid muscle, that muscle is usually 1 ml. We can go up to 2 mLs in the deltoid if there is a large muscle there. Otherwise, the larger volumes are usually for the vastus lateralis or the ventrogluteal muscle. We are using the Z-Track technique in order to give the intramuscular injection, and I'll go over Z-Track technique when I'm actually demonstrating the intramuscular injection itself. So when you are about to give an intramuscular injection, there's first a few things you need to do. Obviously, you need to do all of your safety checks prior to giving any medication. So you want to make sure that you are ready to draw up your medication and bring it to the bedside. You want to perform hand hygiene, identify your patient. We always provide privacy to our patient, check for any allergies, and of course explain what we're doing to the patient, explain the procedure. We'll scan the patient's ID bracelet, we'll perform our safety check and scan the medication, and then whenever we're about to give an injection to a patient, we're going to go ahead and put on gloves and then go ahead and begin the injection process using that Z-Track method. So today I have an injection, I have a zoster vaccine. The dose is going to be 0.5 mLs. I'm going to inject, it's a vaccine, so I'm going to inject that into the deltoid muscle that I have here, for example. And then I have a few choices of needles, syringes, what am I going to draw up? So because this is a 0.5 ml dose, I'm going to use my 1 ml syringe or my tuberculin syringe that has those decimal points on it in mLs, so I'm able to draw up exactly 0.5 mLs and see what I'm doing. And then I have needle choices here. I'm going to be using my blunt needle just to draw up the medication. And then I have an intramuscular needle here, a 22 gauge 1 inch needle, or I have a 21 gauge 1½ inch needle. Now, because I'm going into the deltoid muscle, I'll be using that 1 inch needle. Now, the other thing I need to know is my landmarks for going into any type of muscle. So if I'm using the deltoid muscle, I need to find the acromion process, that area at the top of the shoulder blade, and then I need to measure about 2 to 3 finger breadths down from that acromion process, and then I want to draw or imagine an upside down triangle, And then my injection site's going to be right in the center of that triangle, right on the center of that deltoid muscle. If I were going to be given an injection into the ventral gluteal muscle, I have a mannequin here that you can see your landmarks. My palm of my hand would have to be over the greater trochanter of the femur, and then my fingers are going to be pointing up towards the iliac crest and also up towards the anterior superior iliac spine. My injection site would be then between my fingers, right into that big muscle there. If you're going into the vastus lateralis, like I said, that is the lateral mid-thigh. So we're going to be doing the deltoid muscle. I'm going to be drawing up my medication. The first thing I need to do to draw up my medication out of the vial is clean the top of the syringe with an alcohol prep. I want to go ahead and choose my syringe. Like I said, I'm going to be using that tuberculin syringe. I'm going to be using my blunt needle to draw up my medication. I want to make sure that I sterilely connect the needle and the syringe together, that I don't contaminate. I'm going to pull back the amount of air, volume that I'm drawing up, so that's 0.5 mLs of air. I'm going to go ahead and inject 0.5 mLs of air into my vial, and then I'm going to withdraw that 0.5 mLs of zoster vaccine. Sometimes when drawing up into a tuberculin syringe, you tend to get a little bit of air bubbles. That's okay, you just want to work your way through until you get the amount of volume up. So I have 0.5 mLs drawn up, and then I want to go ahead and change my needle to my intramuscular needle. So we decided that because this is a deltoid muscle that we're going to be using, we'll be connecting sterilely to that 1-inch needle. Okay, so now I want to go ahead and hand hygiene. And then I'm going to go ahead and put on my gloves. Now, remember, we're going to find the acromion process, and I'm going to be 2 to 3 finger breaths below the acromion process. Imagine the upside down triangle. I want to clean my site in a circular motion starting from the inside and working my way out with the alcohol pad. I want to, using the Z-Track method, I'm going to displace the skin. I'm going to go ahead and displace the skin. Holding my needle like a dart, I'm going to enter my landmark at a 90-degree angle. I'm then going to secure the syringe, injecting at a rate of 1 ml per 10 seconds. So for every ml that you're injecting into the patient, you do it at a rate of 10 seconds. Once the injection is all the way into the patient's muscle, I am also going to wait another 10 seconds for that medication to absorb. After that 10 seconds is complete, I'm going to go ahead and remove my needle at the same angle that I took it out, immediately engage my safety, and release the Z-Track method. And of course, right into the sharp spin. If for some reason the site is starting to ooze or leak a little bit or bleed a little bit, I can take a 2x2 and I can provide some gentle pressure at the site. I then want to make sure that I clean up my area. I want to tell the patient that I will be back to check on them in 15 minutes, and also to check on the site to make sure that there's no reaction locally at the site. And I'll put the patient back into a comfortable position, and of course document on my injection, document on the medication administration record, and document on any findings or adverse events that may happen. All right, so that is intramuscular injection. I hope you enjoyed this video. Please like, remember to suggest anything that you want to see in the comments, share this video, and subscribe to my channel. Thank you.